Good afternoon. My name is Kwame McGlory. On behalf of the rest of my group, Allison Mayer, Kirsty Mushinsky, and Christelle Moncada, we are presenting prostate cancer. Prostate cancer is a malignant tumor of the prostate gland. It will affect 1 out of every 5 men in their lifetime, with 75% of these cases in men over the age of 65. It is the most common cancer among men and the second leading cause of cancer death in men behind lung cancer. The majority of prostatic tumors are androgen-dependent adenocarcinomas, which are usually slow-growing. Normal anatomy of the prostate is a small gland about the size of a walnut. It is underneath the bladder and in front of the rectum. The urethra runs directly through it. Nerves for controlling erectile function run alongside and are attached to the prostate. The prostate is divided into 3 zones. The peripheral zone is the outermost area of the prostate, a site of most prostate cancers. The central zone contains ejaculatory ducts. The transitional zone around the urethra naturally increases in size throughout adulthood and is the site for benign prostatic hypertrophy. The prostate is divided into 3 lobes. There is a central lobe that is surrounded by 2 anterior lobes on either side. Normal function of the prostate includes providing sperm with energy and other substances that facilitate fertilization, sperm transit, and survival. The prostate naturally grows through adulthood, causing some symptoms in half of men over 75. However, the prostate is not essential for life. It is only essential for reproductive purposes.
As you can see by this chart, the signs and symptoms of prostate cancer are very similar to benign prostatic hyperplasia. Prostate cancer is asymptomatic in the early stages. As the disease progresses, the patient may complain of dysuria, which includes hesitancy, dribbling, and interruption of stream, and also urinary retention, hematuria, nocturia, increased frequency and urgency, and pain in the lumbosacral area that radiates down the hips or legs. Although erectile dysfunction is associated with prostate cancer, it is not directly caused by the tumor. Erectile dysfunction usually results from the treatment used, such as prostatectomy or hormone therapy. On the other hand, benign prostatic hyperplasia can cause dysuria, such as trouble starting or stopping, dribbling, and weak stream, increased frequency of urination, nocturia, and urinary retention. Discriminating these 2 diseases from each other with a thorough history and physical can be the best diagnostic tool for these patients.
Approximately 241,000 new cases annually, with about 2.5 million men living with a history of prostate cancer. Annually, about 28,000 men will die from prostate cancer. Some of the risk factors for prostate cancer include being over 65 years of age, being African American, and having a family history of prostate cancer. As you can see in the chart, African Americans have a higher male incidence rate per 100,000 compared to other races in the national average. They also have a higher death rate per 100,000 compared to other races.
There are several factors that can decrease the risk for prostate cancer. However, there is no sure way to prevent prostate cancer from occurring. Some of these include limiting carcinogens, such as smoking, charred meat, environment, or occupation, increasing the intake of antioxidants found in colorful fruits and vegetables such as pomegranates, broccoli, bok choy, green and black teas, and horseradish, limiting sugar intake and preventing or controlling diabetes, exercise such as muscle strengthening, and weight loss.
Diagnosis and detection of prostate cancer is achieved mainly through DRE, a digital rectal exam, also through blood work, including a PSA or a PAP. The PSA is a prostate-specific antigen. Normal levels are from 0 to 4 nanograms per milliliter. However, mild increases can be due to age, recent ejaculation, prostatitis, or long bike rides. PAP is a prostatic acid phosphatase. and it can indicate prostate cancer that especially has metastasized to bone. A biopsy is usually done to definitively diagnose prostate cancer. As well, CT or MRI can be used to locate and size tumor growth.
The treatment for prostate cancer usually takes a conservative approach. Surgery, radiation, chemotherapy, and hormone therapy may be indicated. There are 3 types of surgery that may be done, and the first kind is a radical prostatectomy. This is the removal of part or the entire gland that spares the nerves for erectile functioning. The second type of surgery is called cryotherapy, which is the freezing of cancer cells. Orchiectomy is the third kind of surgery, which is the removal of the testes, and this reduces testosterone production by 95%. For radiation, they will use an external beam or they will use brachytherapy, which are radioactive implants. There are several types of hormone therapies that can be used for the treatment of prostate cancer. Androgen deprivation therapy, LHRH antagonists, androgen receptor blockers, and estrogen. These hormones work to either decrease or suppress the action of testosterone. Chemotherapy is limited for use when the cancer is in the late stages and is not responsive to anti-androgen therapy. This is because prostate cancer is not usually responsive to chemotherapy. It is used as palliative care. The standard of care is to use docetaxel in combination with prednisone, exemestane, or mitoxantrone. The plan of care is to have males get annual PSA tests and DREs starting at 50 years of age. It is also important to provide emotional support, to teach catheter use, and to encourage Kegel exercises.
Understanding prostate cancer effects on health is closely related to the severity of the cancer and the metastasis. Depending where the cancer has metastasized to, may cause need for specific interventions to that location. Metastasis can spread by direct extension, lymphatic system, or bloodstream. Direct extension is often to seminal vesicles, urethra, bladder, or external sphincter. Lymph and blood can take to the pelvic lymph nodes, bones, lungs, bladder, and liver. Bone metastasis is the most common site, especially the pelvic girdle.
Prostate cancer can cause GU complications, reproduction complications, and emotional complications. GU complications include urinary retention, frequent UTIs, bladder or kidney stones, and kidney damage. Reproduction complications include erectile dysfunction, often related to treatment, and infertility. Emotional complications include coping with erectile dysfunction, infertility, coping with side effects of chemotherapy or radiation, and coping with hormonal changes due to hormonal therapy.
There are numerous options that are available to assist prostate cancer patients to cope with their condition. US2 International has 325 support group chapters worldwide. There is also the You Are Not Alone Now prostate cancer support group. Male Care is the largest volunteer men's cancer support in the U.S., and the Immerman Angels works by partnering someone fighting cancer with a survivor of that same type of cancer.
Goals for rehabilitation include addressing erectile dysfunction and sexuality concerns, addressing incontinence issues, weight management, protective strategies for osteoporosis, fatigue and sleep disturbances support, and Kegel exercises, which includes pelvic floor muscle strength and improving bladder function and urine flow.
Proper knowledge of prostate cancer can assist nurses in providing individualistic and appropriate care for clients with prostate cancer. Thank you on behalf of Crystal, Kirsty, Allison, and Kwame for your time and attention.
US2 International has 325 support groups,
Depending where the cancer has metastasis. Oh my god, this is hard. Metastasis.
How should I hold my hands? Down?